and welcome. My name is Liz, and I'm a nurse on the orthopedic floor here at Boulder Community Health. First, I'd like to say thank you so much for taking the time to watch this video on your joint replacement journey. In this video, we'll be discussing everything from pre-registration to your discharge home. The first thing I'd like to discuss is your care team. There will be several different members of the team that will all work together to help you succeed. The first member is the nurse, like me. We will be discussing your medical management, going over your medications, making pain plans for your pain medication. I will be monitoring your vital signs and your incision. I'll also be managing your care coordination throughout the other team members. The next member of your team is your PCA, or nurse's aide. They will be helping taking your vital signs, helping you with your care activities, and helping with meals. The next two members are your physical therapist and occupational therapist, and they'll be here shortly to discuss their roles. The next member is your case manager or discharge planner. They'll be helping you with all your discharge needs when you go home. Next is your surgeon. And lastly is you and your family, the most important part of your care team. Next, we'll talk about your pre-registration. The first thing that will happen is our registration department will call you to discuss your information on your insurance and your emergency contact information. They will also set up an appointment with a pre-anesthesia nurse for testing. This nurse will discuss with you your history and physical and decide whether or not you need further testing, like lab work. Another phone call that you might receive is from a pharmacist. The pharmacist will want to know all about your medications, the doses, the frequency, why you take those medications. Please be sure to add your as-needed medications in also. The last thing they'll want to know is if you're on blood thinners. Your surgeon will discuss with you whether or not you should continue or discontinue taking those medications. Next, we'll discuss what to bring here to the hospital. You're able to bring any of your electronic equipment, your laptops, tablets, cell phones. We have free Wi-Fi here. Things not to bring would be any valuables or money. We can't be responsible for misplaced items, so please leave those at home. The night before surgery, you're going to want to eat a light meal and avoid any alcoholic beverages. Also, at midnight, you're going to want to have nothing to eat or drink, what we call NPO. Next is the morning of surgery. If you're able to take any of your meds directed by your surgeon, you'll take those with a small sip of water. When you arrive to the hospital, at least an hour and a half before your procedure, you'll register at our registration department. Next, a pre-op nurse will come and take you back into our pre-op holding area. There, the nurse will start an IV and do paperwork with you. You will also meet your anesthesiologist and discuss different types of anesthesia that are available to you. Your surgeon and your anesthesiologist will discuss the consents and you will sign those. Next, you will kiss your loved ones goodbye and get whisked off into surgery. Once surgery is over, you will go into our recovery unit. The recovery nurses will monitor your vital signs, pain level, nausea, and medicate when needed. Once you're stable, you'll go up to our third floor, our orthopedic floor. We'll discuss a head to toe on what will be attached to you. The first is a nasal cannula going into your nose. This will deliver oxygen. Going down to your arm, you'll have an IV access that will go up to fluids to keep you hydrated. Next, on your finger, you will have an oxygen probe that will go to our central monitoring system to make sure your oxygen saturations are at a good level. Going down, you'll have your incision on whatever joint you had replaced and some sort of cooling device, whether it be an ice pack or an ice machine. Lastly, you'll have your TED hose, which are a white compression hose stocking, and your SCDs on your legs. These help prevent your blood clots. Once you arrive on 3 North, you will be greeted by your nurse and your nurse's aide. We will be discussing a plan of care for you for the day of surgery. We will go over your pain management plan, diet, mobility, and vital signs. Unfortunately, with everything comes risks. So now I will discuss the potential complications that can happen postoperatively. The first one is pain. We will be discussing a pain management plan, how to use the pain scale, and alternatives to pain, such as ice and mobilizing. The next complication is nausea. Don't worry, we have a plethora of medications to help you with this. The third complication is blood clots. Like I said before, we use TED hose and sequential compression devices on your legs to help with this problem. Other than that, you'll be on medications And mobility will also prevent this from happening. The next complication could be pneumonia. We will show you and demonstrate how to cough and deep breathe and using your incentive spirometer. And also, once again, getting up and moving will help prevent this. Another complication could be constipation. We will be providing you with medication to help with this. We'll encourage you to drink a lot of fluids and follow a high fiber diet. And also, again, mobilizing will help with this. The last complication is falls. As you can see from our head-to-toe demonstration, you're hooked up to many different lines. You will need to use your call light to call us when you want to get out of bed or the chair as to prevent any type of fall from happening, unless your physical therapist has said it's okay. The day has come, discharge day. There's certain goals that you have to meet before we'll send you home. As far as nursing is concerned, we need to have you tolerating food and fluids, off your oxygen or at your oxygen baseline, well controlled on oral pain medication, and have met your PT and OT goals. If anything further is needed at home, your discharge planner or case manager will help arrange those items. You will need to have your ride available around noon. We like to get you home around lunchtime so you're able to get home and settle in before it gets too late. Once you go home, it might be handy to have a friend or family member with you to help you the first few days. Also, remember to use your assistive devices that your occupational therapist has given you, to not bend down and pick things up off the floor for the first few days.
Hello, my name is Becky and I'm a physical therapist here at Boulder Community Health. The physical therapist's role for you is to help you with your mobility, and we want to help you get back to the life that you want to live. There are 3 goals for you that the physical therapist will be working on. The first one is getting in and out of a flat bed without any help from your family, and we'll teach you how to do that with your new hip or your new knee. The second goal we have for you is to walk on a flat surface with some kind of assistive device about 200 feet, and that's without someone holding onto your britches and doing it in such a way that it takes the pain off of your affected leg. The third goal we have for you is to go up and down the number of stairs you have at home and the type of stairs you have at home, whether it's with railings or without railings. And we'll be working on those 3 things while you're in the hospital. I'm going to talk next about your schedule while you're in the hospital and what to expect from physical therapy. The day you come up from surgery, once you're settled into your room, if you're up there before 3 o'clock in the afternoon, you will get a visit from physical therapy that day. We will have spoken with the nurse first to make sure your pain is under control and you're not feeling too nauseous. And if everything looks good for you getting out of bed, we're going to help you get out of bed that day. And we're going to show you how to stand and maybe even take some steps with the walker. Some of you will be walking in the room. Some of you will be walking maybe out of the room if everything is going well. And we use a gait belt to hold on to you and to close your gown and make sure that you're safe while you're getting up that first day. If you get up to your room after 3 p.m., we won't be coming in to see you, but the nursing staff will, usually to assist you to the bathroom. But they know to check to make sure everything is working right before you get up out of bed. The next day after surgery, which is considered post-op day 1, you will definitely be getting a visit from physical therapy, and we'll come early in the morning. We will have spoken to your nurse first about pain control, and we'll take you through the steps of how to get out of bed and how to stand and how to walk with a walker, usually is what we start with. This all depends on your ability and how you're feeling, and we will only expect you to do what you can. But if you can, we're going to expect you to be walking in the hallway, and most people are that first day. We will see you twice on day 1, and we will also address going up and down the stairs. We have some practice stairs we use, and we'll be showing you how to do the stairs and what type of equipment you might need on the stairs. If you have stairs with railings, you won't need other equipment. But if you have stairs with no railings, usually in the front entry of a house, you will need a pair of crutches for those stairs. When you're walking in the hallway or on any flat surface, we usually recommend using a front-wheeled walker. But if you prefer the crutches and we feel like you have enough balance and you're safe enough with the crutches, then we'll have you use those as well. If you are not finished with your 3 goals on day 1, then you might need to stay another night and go into day 2. There are also sometimes medical reasons why you need to stay a second day. You may meet your physical therapy goals on day 1, but need to spend the night for another reason. Once we decide that you're able to meet your PT goals and you've met the other goals from your other team members, then you will be discharged. Some of you, once you go home, will want to have home care physical therapy. And if you and your doctor decide that's for you, then we will arrange that here at the hospital. Our case management knows your insurance, and they will know which home care agencies are covered by your insurance. So we will set that up. And that involves a physical therapist coming to your home about 3 times in a week, for a week or 2, depending on what you need. For the total knee patients, you will want to start your outpatient therapy about 7 to 10 days after your surgery. And you need to make those appointments ahead because the outpatient clinics have full schedules. For those of you having hip surgery, you want to wait 2 to 3 weeks before you start outpatient physical therapy. We want you to continue on with outpatient physical therapy because you want to get back to your life and the activity level that you hope to resume. And we hope that for you too. So that's going to take some work and some ongoing weeks of therapy. The length of that is dependent on your insurance and how many visits they will pay for. That appointment is to be made by you, and our case management does not arrange that. You arrange that on your own. Physical therapy will also be helping you decide what equipment needs you have at home and where to get that equipment. Most people go home using a front-wheeled walker. Other patients want to use the crutches only, and we'll help you decide that. There are loan closets in this area that can provide equipment to you for no charge. And that list of loan closet information is also on the BCH website. It's best if you can prepare ahead of time and get your equipment before you come into the hospital, because it helps your care team at home not have that stress of running around town trying to get things for you the day you're going home. We recommend that you get a front-wheeled walker and a pair of crutches and a cane if it's available at the loan closets, because through your progression you may be needing all of those pieces of equipment. While you're here, we can use our equipment. You do not need to bring yours to be used here, but if you want to make sure it fits you and you want it sized appropriately, you can bring it and we'll make sure your equipment fits you exactly. Now let's talk about driving, which is a subject that everyone is anxious to start and get back to their normal lives. When you start to drive depends on which leg that you're having your operation on. If you have an automatic car and you're having your left leg operated on, you will be driving within 2 weeks. If you have a clutch car, or if you're having your right leg operated on, it will be closer to 3 weeks before you can drive safely. Remember, you can't be taking narcotics to drive. It's against the law. So make sure you're off all of those heavier pain medications before you start getting behind the wheel. You may need to arrange rides to your therapy appointments because they will start before you're driving again. So we want to make sure for your safety that you are ready to drive. Some of you may need extended care past your hospital stay if you live alone and if you feel like you cannot handle that without more care. There is an option of going to an inpatient rehab facility. If we and you and your doctor feel that that's going to be a good decision for you, we will help you find a facility. Our case management team takes care of that. If you have Medicare, you're required to be in the hospital for 3 nights before you can go to an inpatient rehab facility. But if you're doing it private pay, then you can go anytime. After your total hip surgery, you will have some precautions to maintain. They put your hip in a certain position during surgery so they can dislocate the hip and put in the new prostheses. And this is the position you have to avoid to repeat any dislocation. The motions are no pushing your leg back behind your body, pushing your leg out to the side, and pushing your leg in an outward rotation movement. Especially the combination of those 3 movements put you at risk for redislocating your hip for a period of about 5 to 6 weeks. While you're in the hospital, we will be helping you learn this. We'll be watching your every move so that by the time you go home, you'll know how to live within your precautions and not be at risk for dislocation.
Hi, I'm Kelly. I'm one of the occupational therapists here at Boulder Community Health. The role of the occupational therapist here at the hospital is to make sure that you don't have any difficulty with bathing or dressing and getting in and out of the bathroom for transfers. We also make sure that you have the equipment that you need for home. Post-op day 1, or the first day after you have surgery, your occupational therapist will come into your room. Prior to occupational therapy coming into the room, we will discuss your pain with the nurse and ensure that you have the medication that you need. When we come in to see you that first day, we'll assess your home environment. We will look to see what kind of equipment that you need for home. Oftentimes, you may need small pieces of equipment, such as a reacher, a sock aid, a shoehorn, or a sponge. We have those here at the hospital and can supply those for you should you need them. However, the lone closets in the community that Becky mentioned also do have those items. Some of you may need a raised toilet seat depending upon the type of surgery that you have. The lone closets in our community often carry those. However, the hospital's elevated toilet seats do not have armrests. If you do need grab bars beside your toilet at home, please ensure that your family has those ready before you return home. The first day that the occupational therapist sees you, we will make sure that you are able to dress yourself. Should you need the adaptive equipment, we will show you how to use that. The reacher can be used by pulling on the trigger and releasing it. The reacher is used to help you get pants and underwear on and off, and to help you get socks off. The sock aid is used to help you get your socks on. You pull up the sock over onto the tube, up to the knots, and make sure the end of the sock is taut on the end of the tube. You place it down on the floor using the handles. You point your toe, you stick your foot in, and you pull up using the arm straps, and the sock will go on rather easily. The next thing that you may require is a long-handled shoehorn, depending upon if you have hip precautions. Primarily, our knee patients do not need long-handled shoehorns, but we have those should you need them. We also do have the option of having elastic shoelaces. The shoelaces can be put in your shoes so you don't have to tie and untie them, but they do stretch and make for ease in getting your shoes on and off easily. On post-op day 1, if you are able to, we will also practice the bathroom transfers. That can include a shower transfer or a shower transfer demonstration, as well as a toilet transfer. At that time, we will also mention and go over some things that you may need in your bathroom based on your specific bathroom needs. If you are still here on post-op day 2, we will then continue to practice bathroom transfers and just functional mobility within the room. One other thing that is of concern for us is if you do have a tub shower with glass doors, if you cannot remove those glass doors, we want to make sure that you just don't use that shower. It can be very unsafe and you are at risk for falls in doing so by using that type of shower. It is best to use a walk-in shower or just a shower stall. Some of the things that we would like to talk about next are some home safety preparations. A lot of times patients come into the hospital and have surgery and they have no one at home with them. What I like to tell our patients is to have your home prepared. Please pick up any small items on the floor or around your areas like couches, TVs, that may cause you to fall at home. Some other things that you can do to prepare for your home is to make meals and freeze them in your freezer, or to make meals ahead of time and put them in your refrigerator. Oftentimes there are many prepackaged items in the grocery stores these days that make it much more easier for someone that lives alone to be able to function well. Some of the things that you can also do to make your home a little bit better and safer for your return home are to make sure that you have a table beside the bed or the place that you're going to stay the most frequently in your home when you return home. One of the things that I like to tell patients is to put a bunch of water bottles or your medication or little snacks or magazines on a table by a couch or a bed that you're going to spend the most time at. That way you don't have to prepare any of that when you do get home, and that it's all ready. Another thing I like to tell patients too is to set an alarm about a half an hour before you want to get up out of bed in the morning to take your pain medication. Your pain medication takes about 30 to 45 minutes to kick in, and that should be sufficient time for you to take your medication, take a little snooze, and then you'll be ready to get up and move pain-free. We recommend that you write down when you take your medications. Narcotics are very strong and can be cumulative in nature and cause you to feel very fuzzy and be a little unsafe. So please do write them down so that you can keep track of when to take your next dose. Thanks for watching our joint presentation. We feel like most of our patients that do watch the video or attend our classes do exceedingly well and have better outcomes. Thanks so much for watching our video, and please feel free to contact us if you have any questions.